Hi, I'm Dr. Craig Castanet. I'm going to demonstrate for you today lumbar spinal decompression. I have Mary Ann here. She works front desk, but she's going to serve as our model today so I can explain how a lumbar or low back spinal decompression works for low back pain. First of all, we have her set up here so she's lying face up. We have this strap around the ribs so it keeps her upper body on that half of the table. We have these restraints here, which are grasping her right above the pelvis here like that. And they are connected to the lower half of the table. This is a table that runs on a piston, and the table is going to separate like this and slowly take her pelvis in this direction, thereby decompressing or taking pressure off of the joints of the low back, the 5 lowermost discs and joints. The reason this is so effective, and it is clinically the best thing I've used in 25 years of treating patients, but the reason it's so effective is because most people have pain and disability for the simple reason that over time our spines get compressed. Discs lose water content, they lose height, the cushion between the bones becomes less, joints then have more pressure on them. There's also less available space then for the nerve roots, which are coming down the little hole down the center of the spine and exiting out the little holes on the side. So it's real simple, it's not rocket science. Spines get compressed with time and gravity, discs degenerate, all that leads to compression on the typical pain generators in the spine, and those are discs, nerves, and joints. So decompressing the spine is a basic fundamental way to treat it. It works for most people. Most people that do that treatment will not have to elect to do injections for pain management, and they won't have to have surgery. There are some people that are appropriate candidates for both of those, and those are a blessing when it's indicated, so I'm not shy to refer people for that when it's indicated. But the deliberate exclusion or the failure to use and exploit spinal decompression for the benefits it confers for so many patients results in many more people getting pain management that could benefit without it from decompressing the spine, and even more surgeries probably than we need. So there is a time and place for all of that, but any effort to manage or treat a problem conservatively, meaning non-surgically and non-invasively in the low back or neck, should include spinal decompression. Compression is the cause of pain and disability. Decompressing the spine is a basic fundamental redress for what ails spines, what makes us hurt and what makes us limited in our abilities. So make sure that wherever you get non-surgical treatment, that it includes, at the very least, a good, effective traction table. And at best, hopefully, a very good spinal decompression table such as we offer here. So let me again explain what's happening. I should note too that people often ask, okay, so I'm getting the spine decompressed, but then I'm back upright. Why doesn't things just go back to the way they were before I had the treatment? And that's a fair question, a good question, but two things happen when you decompress the spine. One is mechanically, and in the short term, you are pulling things apart. But what's less appreciated by even physicians who aren't familiar with the literature is that discs are very influenced by mechanical loads. If you load a disc mechanically, say artificially, say you put a barbell on your shoulders that weighed a couple hundred pounds and you left it there for days or weeks without any remission, that disc would change chemically and physiologically in a very unfavorable way and result in pain and disability in short order. Conversely, if you actually distract a disc and pull it apart, good things happen physiologically. Not just when you're on the table, but it initiates physiologic changes. There's research literature that shows that if you distract an animal's disc, that disc gets more water, oxygen, and nutrients in the disc. That creates a more favorable environment, chemically and physiologically, for the cells that live in the disc. Those cells can then divide and make more cells, and those cells can then manufacture or synthesize or make more molecules to repair the disc. That doesn't mean that you're going to reverse the degenerative changes in a disc to the time when a person was 15 or 20 years old. But you can initiate enough mechanical and physiologic changes to the disc in most people that you give them relief for their bout of neck or back pain, and that should be a central component to the way we're treating neck and back pain until and if that person ever needs pain management in the way of injections and surgery. I should also note that pain management and surgery benefits don't last forever, nor does non-surgical treatment such as spinal decompression. The spine, like many other parts of our musculoskeletal body, wear out and degrade and degenerate and age over time. So what we have to do is intervene intermittently in the appropriate manner to prolong our painless and able lives as much as possible. And generally that should start with conservative measures. So you should decompress the spine always first for any bout of pain, even after the person has had effective pain management and surgical treatment. The next time they have a bout of pain management, or rather pain, even after they've been helped in the past with pain management and surgery, they should have another trial of decompression, because there are many potential sources of pain in the back, and just because you effectively address one with pain management and surgery doesn't mean that that's the same source of pain and that they shouldn't be treated effectively through conservative treatments again the next time they have a bout of pain. So that's how it works mechanically. It's pulling apart to separate the lumbar vertebrae and get pressure off of the pain generators in the low back, i.e. the discs, nerves, and joints. And physiologically, it's initiating changes that are beneficial to the person for typically many months to several years of relief. And of course, they will have pain if they live long enough again. And again, you go back to do a little more decompression. And of course, we include physical therapy exercises as well, strengthening of the core, all of that. But strengthening of the core is done to protect the spine. It doesn't decompress the spine. Those are independent things, and the spine problems have to be addressed independently. You have to assess the extent to which a compressive problem is a source of pain and disability. And then as an insurance policy, so to speak, you want to strengthen that core so the person is less likely to have bouts of back pain and neck pain because they've done some physical demand that exceeded their tolerance for it, because they had weak muscles, and as a result their spines were more abused by that particular physical demand. Anyway, that's it. Thanks for listening.